Ever wondered what vital signs are and why they are so crucial in the medical field? Vital signs are a collection of key measurements that give us a snapshot of your body's basic functions. They include body temperature, heart rate or pulse, respiratory rate, and blood pressure. These measurements are essential tools in assessing health, providing a quick overview of a patient's physiological status and aiding in the diagnosis of potential medical conditions. In the next few minutes, we'll delve into each of these vital signs and understand their significance. First up, body temperature, a key indicator of your body's health. When we talk about body temperature, we're really talking about the balance your body maintains between generating heat and getting rid of it. It's like your body's thermostat, keeping everything running smoothly. Now, our bodies are pretty smart. They've got this normal range, typically around 98.6 degrees Fahrenheit, give or take a degree. But what happens when we step out of this range? Well, that's when things can get interesting. A fever or a body temperature above 100 degrees Fahrenheit might suggest an infection. On the flip side, a drop below normal could indicate hypothermia. These are just examples, but they illustrate a critical point. Even small changes in body temperature can signal something major happening inside your body. So a simple temperature check can tell a lot about what's going on inside your body. Next, we have the pulse, a live ticker of your heart's activity. This vital sign, the pulse, is much more than just a rhythm of beats. It's your heart's language, speaking volumes about your health. The pulse, in essence, indicates your heart rate and rhythm, and the strength of your heartbeat. With every thump, your heart pumps blood to every corner of your body, and the pulse is a testament to this life-sustaining process. Now, a normal pulse range for adults is between 60 and 100 beats per minute. But what if it strays from this range? A faster heart rate could indicate stress, anxiety, or even more serious conditions like arrhythmia. On the other hand, a slower rate could be a sign of a well-trained athlete's heart or maybe an underlying heart condition. Just by feeling and interpreting the pulse, we can get a sneak peek into the heart's functioning. Pulse, thus, helps us gauge the health of your heart quite literally. Moving on to the respiration rate, your breaths count per minute. It's one of those vital signs that subtly whispers the state of your respiratory system. How so? Well, it's pretty simple. Every breath you take allows oxygen to enter your lungs and carbon dioxide to leave. This exchange is crucial for your body to function optimally. Now, a healthy adult at rest usually has a respiration rate between 12 and 20 breaths per minute, but this can be influenced by several factors such as age, fitness level, and even emotional state. For instance, a fit athlete may have a lower rate, while a stressed individual might breathe more rapidly. But what happens if the rate deviates from the norm? It could hint at a potential problem. A higher rate might indicate conditions like fever or lung disease, while a lower rate could suggest narcotic use or brain injury. Your respiration rate, thus, is a window into your respiratory health. Finally, let's talk about blood pressure, the force exerted by your blood against your arteries. It's like a barometer for your body, reflecting the health of your heart and blood vessels. Blood pressure is measured using two numbers. The first, or top number, is called systolic pressure. This measures the pressure in your arteries when your heart beats. The second, or bottom number, is the diastolic pressure. This gauges the pressure in your arteries when your heart is at rest between beats. Generally, a normal range for blood pressure is around 120/80. If your blood pressure is consistently higher, you might be dealing with hypertension, a condition that can lead to heart disease if left unchecked. On the other hand, low blood pressure or hypertension can cause dizziness and fainting. In essence, blood pressure is a vital sign that keeps us informed about the pressures within. Now that we've explored each vital sign, let's piece it all together. Body temperature, our first stop, is a crucial indicator of our body's functioning. Next, the pulse, the language of our heart, signaling its rhythm and strength. The respiration rate, our breath of life, reflects the efficiency of our lungs. Lastly, we dove into blood pressure, the pressure within, vital for delivering nutrients and oxygen. Each sign plays a unique role in maintaining and assessing our health. Remember, understanding your vital signs is a step towards better health awareness and care.